I'm going to show you the MRIs of Jerry. This first picture is dated May the 9th, 2001, and it is an MRI of the brain without contrast. A mass is noted in the right hemisphere. I want to orient you to where we are. The top of the screen is the front of the head or brain. The bottom of the screen represents the back of the brain. The pointer is on the right hemisphere. Now the pointer is on the left hemisphere. I want to point out that this is the right ventricle, and then this is the left ventricle. What we see here is a tumor in the right hemisphere pressing the right lateral ventricle. The main part of the tumor is where is this slightly increased whiteness, and then surrounding the tumor is the edema. What we see here, the right hemisphere is pushed over to the left hemisphere. We see the right lateral ventricle being compressed by the tumor. This is Jerry's MRI of the brain with contrast. Here we see the tumor that's outlined in white. And you can see that it is in the right hemisphere, and surrounding the tumor is the cerebral edema that is gray. The tumor is pressing the right lateral ventricle across the midline. And you can see that the tumor is also compressing the left lateral ventricle. This is the MRI of the brain of Jerry taken on November the 2nd, 2001. This is the non-contrast MRI of the brain. He had just had a course of chemotherapy and the steroids. And what you see is that the mass and mass effect has gone. There's a small area of increased signal next to the frontal horn of the right lateral ventricle. But the significant shift and compression of the right lateral ventricle that we saw on the previous MRI has disappeared. You also noted that the left lateral ventricle is well seen and not compressed. This is the MRI of the brain of Jerry taken on November the 2nd, 2001, following the injection with contrast. What we see here is that the area on the non-contrast scan just anterior to the right lateral ventricle is not enhancing. On the previous MRI, we saw that small area of increased signal, and here it is again, but it does not enhance. We also noticed that the right lateral ventricle and the left lateral ventricle, both of these ventricles are not shifted. So this particular MRI shows considerable improvement from the previous MRIs. This MRI shows that the tumor has resolved or gone. This case is extremely important for a number of reasons. His headache complaints were nonspecific. He was describing bitemporal sharp pain. When he first saw his family physician, he was treated for allergies. In terms of his complaints, he mentioned that he listed to the left when he walked. This is an extremely important point and helps to separate a secondary headache disorder from a primary headache disorder. This would also suggest that an MRI of the brain or a CAT scan of the brain be done, both with and without contrast. This case shows how important it is to do a fundoscopic examination on every patient with headaches, looking for papilledema. And finally, the patient presented with new onset headache and was over the age of 50. And I think you'll find these are key points of the history.